Hi, Dr.
Okay.
Asti. Hi, everyone.
Hi.
Thanks so much for jumping on. As you can see by the title, the topic for the live this evening is egg collection. Last night we covered endometriosis, and the topic for tomorrow's live will be insemination. Before we dive into the topic this evening of egg collection with the questions that I have prepared, Dr. Asti, could you please give a brief introduction on the topic?
Thank you. Thanks, Gabby. Thanks, everyone, for joining today's live stream. Yes, so today we'll be discussing egg collection procedure, which is a part of IVF treatment cycle. So generally, eggs are most important factors which determines outcome of IVF. So generally, egg quantity, egg quality, and the maturation is by far the biggest factor which determines how many high-grade embryos you get, then whether you have successful implantation or not. Because if you get multiple high-grade embryos, then very likely you will get a successful implantation. So, and that's determined by how many eggs you produce. The quantity of eggs you produce in each cycle of IVF is very important factor. Generally, we want to get 10-15 total number of eggs per cycle of IVF. So, depending on your egg reserve, it may or may not be achievable, but this is the optimal number to have a good number of high-grade embryos, like 3-4 high-grade embryos. So, and the quantity of eggs are important, and also the maturation of the eggs are also important, and the also quality of these eggs are important. So all these things like egg factor, we call egg factors which are egg quantity, quality, maturation, is determined by 5 things. First is your baseline ovarian reserve, your egg reserve. So if you have high egg reserve, your likelihood of getting a lot of healthy eggs is good. If you have low egg reserve, your likelihood of getting a lot of high quality eggs is low. So baseline egg reserve is the first factor which determines the egg factors. Second is a natural variation on the quantity of eggs you have any given time or when you start IVF treatment. Let us say on your day 1, it depends on how many follicles you have and the size of those follicles. Let us say you have average egg reserve, your AMH is 15, your antral follicle is 20. So in certain months you may have more antral follicles, 25, 30 antral follicles. In some months you have less antral follicles. That's called natural variation, and size of those follicles on day 1 of the stimulation. So if you have plenty of follicles ready to go, larger, let us say 7, 8, 9 millimeters, 10 millimeters, then you can have a good number of eggs. So baseline egg reserve and natural variation of your egg reserve. And the third factor is you respond to stimulation, which means how your follicles respond to the drugs. How many follicles go through the activation phase and grow and become bigger than 13, 14 millimeters. So that's called ovarian response to stimulation. So there's a lot of factors determines, including what drugs you use, dose of the drugs. So third factor is the maturation of your eggs. So, and if you have a good size of follicles, if FSH and LH, which is a trigger drug, and stimulation drug is a really matching, and if you have a good maturation, you have plenty of mature eggs. So egg reserve, baseline, and the natural variation, and your response to stimulation, your maturation of your eggs, and the fifth factor is your egg collection procedure, which means whether you had any problems accessing your ovaries, whether your specialist has managed to aspirate all follicles, small and big follicles, to get as many eggs as possible in that given cycle to give a good chance of successful pregnancy. Let us say you may have a good response, good maturation. If your ovary is not accessible, it's very high, or if you're having pain during the egg collection, if your all follicles not aspirated fully, if all follicles not aspirated, you may get a low number of eggs, and a lot of mature eggs might not have been aspirated. So this why egg collection procedure is also important factor. So 5 factors determine your egg factors in IVF. So one of them is egg collection procedure. This is why we need to understand this egg collection procedure so that we optimize that one as well. So, and the egg collection procedures got different names. Egg collection. So you see or OPU, oocyte pickup or egg pickup. So egg collection, we have different names. So essentially, it means same thing. Essentially, aspiration of follicles and get eggs from your ovaries when you do IVF.
Thank you so much, Dr. Asti. My first question, could you please explain the pre-procedure admission process for egg collection?
Yes, so briefly I'll explain the IVF stimulation, so which leading up to the egg collection. So let's say you have a period, on first day of your period, you do blood test, tell your nurses, and then they ask you to start injections to stimulate the ovaries. The stimulation daily injections last approximately 10 days, and you have a monitoring blood tests and scans. Once you see a lot of large follicles, they're ready for the trigger shot, then you do trigger shot. So that's the stimulation part of first stage, which is stimulation part of ovaries that lasts approximately 10 days, 8 to 10 days. So then once you do the trigger, approximately 36 or 37 hours after the trigger, eggs will be fully mature. So if you delay, gradually you may start ovulating. So, and this window is fairly large. It's not exactly 36 or 37 hours. So eggs goes into the maturation phase maybe after 33, 34 hours and stay mature maybe until 38, 39, even 40 hours. So, but in the middle is a 36, 37 hours after the trigger, which means you do the trigger shot 9 p.m., let us say Saturday night, then Monday morning 9 a.m. or 9:30 a.m. you should do egg collection. So you do trigger shot, then nurses send instructions saying now you wait 36 hours before egg collection. So you don't do any injections, you just wait. And then you prepare for egg collection procedure. So you establish where this clinic is, where the operating theater is, or procedure room is. So then you receive a phone call from the nurses, theater nurses, who will explain procedures for admission. So what you need to do for admission. So what preparations you need to make for admission. So you find out where the hospital, car parking, and all this things, payments, and all the stuff. So all this logistical stuff, so that you don't have any stress on the day. So you have to do it leading up to the day of egg collection. So then you need to fast for egg collection, because if you don't fast, if you have any vomiting during the procedure, then you may have an aspiration, so which can be very serious. That's why very strictly you need to fast approximately 6 hours before the egg collection procedure. So, and that fasting instruction, you need to follow your clinic's instruction. Different clinics may have different instructions. Generally, you should fast at least 6 hours before egg collection procedure. So, and then you get all these fasting instructions, then leading up to the egg collection in the morning or afternoon of the egg collection, you get admitted to the hospital a couple of hours before the procedure. So then first thing happens is you go through like normal admission process. The nurses will go through all the questionnaires. So then you get admission to pre-procedure room. So before your procedure, you see different people, usually admission nurse will be coordinating everything, but you should see 3 professionals. So your fertility specialist, your embryologist or scientist, and also anesthetist. So your fertility specialists, if they have already explained a collection procedure previously, they don't go into detail, they briefly explain and get the consent. If you didn't have an explanation of a collection procedure, they will explain the procedure, then they will ask you to sign a consent. And very importantly, your fertility specialist and scientist make sure that your trigger timing was correct. That's very critical. So if your trigger timing was wrong, or if you had any problem with the trigger, you need to tell before you do a collection. Let us say, for example, you triggered very early, let us say much earlier than planned time, you might have already ovulated. If you triggered late, you can do a collection, but you may not be able to get mature eggs. So you should tell exact time of your trigger and what trigger injections you used. And so that needs to be verified, usually verified, definitely verified by embryologists and also verified by fertility specialist. So, and if you have any question, the address, then your embryologist will explain. So what's going to happen in terms of handling of your gametes and embryos. Gamete means egg is gamete and sperm is gamete. They are not embryos yet. Embryo means once fertilized, they become embryo. So they will explain how your gametes will be handled. So what will happen behind the scenes in the lab. So they explain egg collection procedure. So they explain that if they are doing IVF, how they perform the IVF procedure. If they're doing ICSI, they will explain how they do ICSI, then how the embryos created, and how you get informed about how many embryos created, in incubation and embryo transfer. They go through everything, what happens in the lab, so before you do egg collection. So then anesthetist goes through anesthetic questions, all this health questionnaire, health risks, and if you have any medical problems, any allergies, any previous difficulties with anesthetic, then you need to tell the anesthetist. So then they review everything, make a plan for that, and then they will explain how they're going to put you to sleep. So generally, we'll probably discuss as part of one of the questions. So different types of anesthetics you can use egg collection. So essentially, they will explain whatever anesthetic they're using for egg collection. Then after that, you move to a procedure room, and you have egg collection.
Thanks so much, Dr. Asti. Just then you touched on anesthesia. Could you please explain what kind of anesthetics patient receives when undergoing egg collection?
So generally, there are two types of anesthetics you can use, maybe three types of anesthetics you can use. So you can use just local anesthetic in green whistle. So it's very basic anesthetic, which means you're awake. You can feel some pain, but pain may be minimized. So then you can have a light sedation and local anesthetic, again, which means you will be a little drowsy, but you will be awake. You can feel some pain, and additional pain analgesia can be added to it. But third type of anesthetic is a best anesthetic, is a deep sedation or light general anesthetic. So in deep sedation or light general anesthetic, you will be fully asleep, and you will not feel any pain during the procedure, and you will not recall the procedure. And that's most optimal anesthetic which we use in our clinic. So usually it's achieved using drug called propofol. Other different types of drugs you can use, but generally it's used propofol, because with that drug you go into deep anesthetic very quickly and you come out of anesthetic very quickly. It's not like general anesthetic. In general anesthetic you have muscle relaxants and it's very deep, and then recovery is also difficult, and you can have a lot of side effects. But deep sedation or light general anesthetic, so we call deep twilight sedation, is most optimal for egg collection, because first it's very fast and very safe. You go straight deep anesthetic, full sleep, no pain. Then you come out of anesthetic very quickly without any significant drowsiness, without any significant side effects. So yeah, so that's the, and also when you have a full sleep, deep sedation, then it's easier. Of course, you won't feel pain. It's much easier also for your specialist to do a collection, because of course you don't have any discomfort. You will not be moving during the procedure, and then it's easier for fertility specialists to do proper aspiration of follicles and aspirate all the follicles and get as many eggs as possible.
Thank you so much, Dr. Asti. Could you please explain the procedure and how the eggs are collected?
Yes, so after, essentially what happens is when you go into the operating theater or procedure room, so first thing happens is you have IV line, so for anesthetic. Then you have a series of ID checks. Usually the theater team does their own ID check. ID check means like a 3-point ID check minimum, so your age, your name, full name, your date of birth, and your address, for example. So then fertility team does their own ID check. Fertility specialists and embryologists or scientists do ID check. Again, 3-point ID check to ensure that's you. So your name, date of birth, and your address. And then also they do ID check manually and electronically. They check your test tubes where we collect the eggs against your name, your ID. So electronically, with a tracking system, and also manually with 2 people witnessing. So every point of handling of gametes need to be witnessed by 2 people, and also it should be tracked electronically. You confirm your name, then against that ID we check your tubes already have your own name in electronic tag. So no way it can they can make a mistake, because like 2 people checking manually as the 3-point checks, and also it's being tracked electronically. So you do ID check and you like 1000% sure that's this patient's tube for egg collection. It's being tracked and double checked and manually witnessed, and then you are sure that then you can start the procedure. So you have general anesthetic, then internal scan, transvaginal scan. It's same scan as patients have during monitoring, transvaginal scan. Only difference is we attach a needle to the tip of the transvaginal scan for aspiration of follicles. So then after doing transvaginal scan, then aspiration process starts. Actual procedure is very simple, very safe, straightforward. Generally lasts approximately 10-15 minutes. So we do aspiration systematically. So when ovaries stimulated, enlarged, they become big, like 10-15 centimeters, and then they usually come down to the pelvis and sit just next to the vaginal wall. So essentially you don't have any space between ovary and the vaginal wall. So you go to the one side, let us say start from right side, you just you put the scan probe and pierce the needle through the vaginal wall, and straight you go to the ovary. There's no gap. So literally between your needle and follicle and egg is maybe literally like 3-4 millimeters, 3-5 millimeters. So you go straight to the ovary, and then usually it requires 1 puncture for each ovary. So 1 puncture to the left ovary, right, 1 puncture to the right. Why? Because you go with 1 puncture, then systematically collect the follicles. It's like picking fruit, yeah. So it's like let's say you're picking I don't know, grapes, for example. Yeah. So you start from one end. What happens is you start with the first follicle. When you aspirate, that follicle collapse. Then next follicle comes to next to the tip of your needle. Aspirate, and all of them one by one collapse, and ovary gets smaller and smaller and smaller, and you keep collapsing the follicles with using single puncture, and you can go to the all follicles and aspirate. You can get, I don't know, 5, 10 eggs, 50 eggs, depending on how you responded to stimulation from each ovary. So sometimes you need to make another puncture, because let us say you have very high response, some of the follicles not accessible, then you need to take the needle out, flush, and go again and aspirate all the follicles. So very importantly, in egg collection, essentially there are 2 different techniques, and some technique is where you aspirate mainly big follicles. Second technique is you aspirate all follicles. So that second one is best, because looking at the follicle size, we cannot tell, oh, this is going to give us a mature egg or not. We don't know. So we need to aspirate smaller or big, all follicles fully, and give that fluid to the embryologist, and they go through this fluid. Embryologist looks through the fluid and picks eggs from the fluid. So this is why aspirating all follicles of both ovaries is the most optimal technique, which ensures you get as many eggs as you can. Like we said, number of eggs you get is one of the biggest factors which determines your success in IVF. So then you pass the fluid to the embryologist immediately there, and then embryologist checks and picks the eggs and puts a special dish, and they double check the fluid. Then they take the fluid, leftover fluid, to the lab, and then double check with a much bigger microscope to make sure that we haven't missed any eggs. So that's why we get initial number, then it gets double checked in the lab, and if there's some additional eggs, if they find, they add to the number, and you get total number of eggs. So so then once you aspirate, then stop the procedure to make sure there's no bleeding. The chance of bleeding in a collection is extremely small. So chance of any complication is very low, because here it's very simple procedure. Using needle, goes straight to the ovary, and risk of any injury, infection, bleeding is extremely low because it's a very simple procedure. So yeah, so the whole procedure lasts about 10-15 minutes. You would complete the aspiration, then patients move to the recovery room and they wake up within like 10-20 minutes after the egg collection, even if they had a deep sedation, and they get observed for a while, then they will be discharged to home.
Thank you, Dr. Rusty, for explaining the egg procedure the egg collection procedure in great detail. Could you please explain what the recovery is like for after the procedure? Do patients experience pain?
So after the egg collection, so they stay in the recovery area. So and the nurses, recovery nurses, ensure that all vitals are fine, patients recovering well, blood pressure, heart rate, and temperature all looks normal. So they observe, and the patients recover quickly without significant side effects of medications. So then, of course, we observe for a couple of hours after the egg collection, then discharge home. Generally, most patients don't have any significant pain. Patients who have endometriosis, some chronic pelvic pain may have a more pain, but if they need more strong analgesia, we give strong analgesia and observe. Once they feel fine and fully recovered, then they're discharged home. But of course, so they had anesthetic. Of course, they can't drive that day. They need to come with accompanying person, and also they need to have someone, responsible adult person with them to observe next 24 hours because they had a procedure, and also the sedative medications will be in the system, and they can't work, they can't drive, they can operate any machines next 24 hours after the egg collection. Pretty much after that, the recovery happens fast, and then patients get back to normal quickly after the egg collection.
Thank you so much, Dr. Rusty. My final question, are there any difficulties that come up during the egg collection procedure?
Yeah, so generally most patients don't have any difficulty because, like we said, ovary is very visible on ultrasound scan, especially if response is good. If you have lots of follicles, especially, very, very easily accessible. But in some patients, it may be difficult to access ovaries, one of the ovaries or both of the ovaries. Usually this happens in two different conditions. One is severe endometriosis, patients with severe endometriosis like stage 3, stage 4 endometriosis, where there's adhesion because of endometriosis. If ovary is very high because of scar tissue, it is staying very high in the abdomen. So that ovary, some ovaries may not be even visible on transvaginal scan because the beam of the transvaginal scan goes to 10, 12 centimeters. So if ovary is high, sitting higher, then you may not be able to see on transvaginal scan. So in endometriosis, you can have this problem, severe endometriosis, which is not common, which is rare. So and also in uterine fibroids, especially if you have a big intramural fibroids where the uterus really pushed up high. So the uterus, when it grows, it can take the ovary with it to the abdomen. So then it may be difficult to access the ovaries. So usually if this happens, if patients are under anesthetic, we can try and bring the ovary down by pressing on abdomen and the tummy of the patient. And let us say left ovary is high, we just push with the hand to try and bring it down. And so then if we bring it down to the pelvis where close to the vaginal probe, then we do aspiration. So because if you can't bring the ovary down, we cannot do aspiration. Why? Because essentially you should not have any distance between your needle and the ovary. So if you have a distance, that it's too risky because your bowel can come on the way, blood vessels come, so it will be too dangerous. So that's why we can't do aspiration. If ovary is very high, it's not possible to bring ovary down during egg collection. But this is very rare. In most patients, like I said, when you do aspiration, ovary is accessible and you easily access both ovaries into aspiration. So yeah, so that this is technically, these are the difficulties. In some patients, of course, for various reasons, they may not get egg or may not get expected number of egg. Especially this happens if egg reserve is very low, if follicle number is very low, like 1 or 2 follicles. So if eggs don't go through the maturation, if number of follicles small, then of course there's a risk of getting no egg or low number of eggs. Usually patients get warned about that. So in some patients, unexpectedly, they can have a low number of eggs or poor eggs. Usually it happens if trigger doesn't work. Usually if trigger was given late, or if they have a very significant LH-FSH receptor deficiency, which is not common, which is very rare. In most patients, we get expected number of eggs.
Thank you so much, Dr. Asi. That was a really insightful live. So as I mentioned in the beginning of the live stream, the topic for tomorrow's live will be insemination. As always, the recording of this live will be uploaded to Dr. Asti's social media channels. Thank you so much, Dr. Asti, for your expertise in this area as always. And thanks so much for those that jumped on this evening.
Thank you. Thanks, Gabby, for organizing. Thanks, everyone, for joining.
Thanks, everyone. Bye.
Thank you.